My name is Dr. Rebeccca Stachniak. I went to medical school here in Texas, which is my original connection to the state of Texas. I was trained out east at the University of Florida, where I was privileged to train under one of the most famous neurosurgeons in history, Dr. Albert Roten. And I've led a 20-year practice here in Dallas, where I've not only clinically taken care of people, but I've been involved in 7 different FDA studies. I have patents, and I've been involved in community work, as well as the general practice of neurosurgery, both cranial and spine. People have heard about neurosurgeons or neurosurgery, and I think that many people think it's just people who operate on people's brains, but it's so much more complex and diverse than that. It basically involves a specialty that involves operating on nerves anywhere in your body, which means it's a combination of cranial surgery and spine surgery and peripheral nerve surgery. So anywhere in your body where you have anatomy, you have nerves. Anywhere in your body, a neurosurgeon has to know how to operate on you and care for you. And that can happen in trauma surgeries, it can happen in degenerative surgeries, tumors, and all of the other multitude of basic kinds of clinical surgeries that we have to do. I would say in today's day and age, most neurosurgeons spend probably 70 to 80% of their time doing spine. And it's very unusual, even in today's day and age, that many people feel that spine surgery would happen from someone who was an orthopedic surgeon. And they don't realize that neurosurgeons are the people that would be responsible for those kinds of surgeries. I originally became a doctor. My dad was a dentist, and I was exposed to medicine and clinical care for people from the time that I was a little girl. I originally planned on becoming a urologist. I always knew that I wanted to become a surgeon after medical school, and I found that it was neither clinically interesting enough or hard enough, and I've always been best at whatever I did and always wanted to do the very most difficult thing. I've spent my life doing both cranial and spinal work, and I've been lucky enough to be in a practice where I not only have taken people who are paralyzed and given them back their limbs, but helped people who were dying to get life. I think one of the most memorable for me was a very kind gentleman who fell on his bathroom floor here in Plano and woke up completely quadriplegic. He had no sensation or movement from his neck down. He screamed for his wife, and he was taken to the emergency room at Presbyterian Plano, and initially he had absolutely no function. He had very severe degenerative disease in his neck, and we had to do a 2-step, very complicated operation on him, and we were able to improve his situation slightly after surgery. He could move his fingers and his toes, and I remember having long discussions with him at that time, and I told him, this is really great news, and we have so much to be thankful for, and there's so much possible. And it's sometimes difficult, I think, when we sit on our side of the bed to realize how amazingly emotional and difficult that could be for somebody who's actually going through it. But through his own work and work with us over the course of the year, the following Christmas, he was able to regain almost all of his function, and he was able to spend Christmas with his family, walking and moving almost completely normal. I think things like that are always wonderful surprises for neurosurgeons. Just when we think we might have it all figured out and we understand everything, we get surprised in wonderful ways. I like to bike. I've biked in many places all around the world. I've been lucky enough to bike in the big mountains of the Tour de France during the 100th anniversary of the race. I rode with some friends up into 7,500-foot mountains. I consider it to be one of my greatest accomplishments as a human. But to be in the middle of the Tour de France race is amazing, and that's something that I don't think people can imagine. I think all doctors should be passionate about what they do. If you're not passionate, I don't think that you have any business getting up in the morning and doing this job. I think that it's something that you can only do 150%. And always should be something that people are looking out for the interests of the patients first and not themselves.